Episode 3 of Sperm Can Find a Way, crazy ways that people have gotten pregnant. Today we're going to talk about pregnancy after a bilateral salpingectomy. We've talked in the past about how there are failure rates for certain types of tubal ligations, and I've said before that the failure rate for a bilateral salpingectomy or a full removal of both fallopian tubes is as close to 0 as you can possibly get. But notice that I don't say 0. This systematic review was published last year, and it shows 4 cases of spontaneous pregnancy after a bilateral salpingectomy. Now, I think it's important to note that a lot of people get their bilateral salpingectomy for contraception to prevent pregnancy, but there are some who have their fallopian tubes removed for other issues, like repeat ectopic pregnancies, pain, those sorts of things. And interestingly, these 4 cases of pregnancies all happened in people who got a bilateral salpingectomy for something other than sterilization. It makes me think that there might be some anatomical differences or maybe a fistulous tract that was caused by previous disease that caused that sperm and the egg to meet and to implant in the uterus without a fallopian tube. None of those 4 pregnancies ended up in a viable pregnancy, but if you Google baby after bilateral salpingectomy, you will come across this news story. This patient had a bilateral salpingectomy for sterilization. She did not want any more children, and a couple years later, miraculously got pregnant. The thought was that maybe the previous doctors had botched her surgery, but during her C-section, both of her fallopian tubes were completely gone. My only thought here is that maybe there was just a tiny little hole left in that fallopian tube stump, and somehow in one way or another, the egg came in there, the sperm went in there and met and implanted. I don't know. But this also has not been a case report and was not included in that systematic review, which was taken 3 years after the birth of this baby. So I'm wondering if there's some miscommunication because, again, I can't find like a case report and medical journal on this miracle pregnancy. And let me just say, we say that your bilateral salpingectomy is as close to 100% effective as it could possibly get. Please don't worry that if you've had your tubes completely removed, that there's a big chance that you can get pregnant. These cases are like 1 in a billion.